the Trump administration's handling of the escalating avian influenza outbreak has sparked widespread alarm and confusion among federal employees, state officials, veterinarians, and public health experts, according to 11 sources who spoke to Reuters. The disruption, characterized by a breakdown in interagency communication and a significant curtailment of information sharing, has severely hampered the nation's response to the rapidly spreading virus. Since President Trump's inauguration on January 20th, a pattern of obstruction and secrecy has emerged within the federal agencies tasked with monitoring and mitigating the bird flu epidemic. Two key agencies have been implicated in withholding crucial reports on the virus's progression, abruptly canceling scheduled briefings to Congress, and effectively silencing communication with state health officials. This deliberate suppression of information has created a dangerous vacuum, leaving those on the front lines of the outbreak ill-equipped to effectively manage the crisis. The consequences of this communication breakdown are already being felt across the country. The administration's controversial decision to withdraw the United States from the World Health Organization, WHO, has further exacerbated the situation. 3 sources confirmed that this move has severely restricted access to vital international data, hindering the ability of U.S. officials to track emerging strains of the virus and monitor outbreaks globally. This lack of real-time intelligence is particularly alarming given the highly contagious and rapidly mutating nature of avian influenza. Effective pandemic preparedness demands a robust system of international collaboration and information exchange, a system that has been systematically dismantled under the current administration. The human toll of this negligence is mounting. Nearly 70 individuals in the U.S. have contracted the virus since April, resulting in 1 fatality. The economic impact is equally devastating. The outbreak has led to the culling of approximately 159 million chickens, turkeys, and other birds nationwide, sending egg prices soaring to unprecedented heights. This stark reality directly contradicts President Trump's repeated promises to lower costs for American consumers, underscoring the catastrophic consequences of his administration's mismanagement of this critical public health emergency. The consequences extend far beyond the immediate CRA. The planned freeze on federal funding for disease control and prevention programs adds another layer of complexity and uncertainty to an already precarious situation. This budgetary constraint, coupled with the communication breakdown and the WHO withdrawal, creates a perfect storm of dysfunction, leaving the nation vulnerable to future outbreaks and jeopardizing the health and well-being of its citizens. The lack of transparency and the deliberate obstruction of information flow raise serious questions about the administration's commitment to protecting the public health. The situation demands immediate action to restore open communication, re-engage with the international community, and adequately fund the critical agencies responsible for safeguarding the nation's health security. The current trajectory is unsustainable and poses a significant threat to both public health and economic stability. The ongoing crisis serves as a stark warning of the devastating consequences of prioritizing political ideology over scientific expertise and public health. The lack of coordination and transparency has created a climate of fear and uncertainty, undermining the public's trust in the government's ability to effectively manage crises of this magnitude. The urgent need for comprehensive reform and a renewed commitment to collaboration is undeniable.